Welcome back to What's Really in Your Best Interests. We're with Dr. Wendy Warcholik, lead researcher, Ph.D. economist for the Family Prosperity Index. Wendy, there'll be a very detailed report just on Rhode Island coming out in the coming months and a rollout with some public relations and other activities. Can you tell us what Rhode Islanders can expect?
Sure. Well, we're excited to come to Rhode Island, and we'll bring our report with us. And our report will be a detailed analysis of where Rhode Island is succeeding and where where the state can improve. As we've already discussed, we look at 6 major categories, and Rhode Island is in the bottom 10 for 5 of our 6 categories. So we'll do a deep dive into those 5 major categories where you're not doing so well, and try to identify why that is. And then we'll do an analysis of your border states and how they're doing overall. So we'll be looking at family health, which is substance abuse and other factors, family self-sufficiency, which is government dependency, your demographics, your age structure, your economics, and family culture, which is factors like prison population, charitable contributions, that kind of thing. So we'll bring our report with us, and we look forward to meeting with stakeholders in Rhode Island to discuss the findings and talk about how they can use the index as a roadmap to develop effective solutions that will work to improve the prosperity of families and everyone in Rhode Island.
Well, we look forward to that. And I know a couple of specific factors. You mentioned some of the 6 categories, but there are a couple of specific factors that jumped right out at you: substance abuse and what you call a demographic winter. Can you explain that in terms of Rhode Island and what those mean?
Sure. Well, demographic winter looks at your age structure, and Rhode Island, just like the rest of New England, is suffering from net natural population decline, which is you have more deaths than births. So you're not Rhode Island isn't producing enough young people to keep up with the number of old people that will need increased services
or
as they
attracting
age.
young people, right?
So your labor force in the future will be shrinking, and entrepreneurship may be on the decline because entrepreneurship is mostly the game of young people. They're the ones starting up new businesses. So that is a very that's a very big factor that we need to address. Also, substance abuse is. We've heard in the presidential elections that New England in general is suffering from a significant heroin problem, and they've been at the federal level. There've been emergency appropriations to increase the number of treatment centers in New England, and so the traditional response to any kind of drug epidemic is to appropriate more money, but indeed it is a much more complex problem than that. And so we hope to look at substance abuse in Rhode Island and try to identify what other factors are related to that substance abuse, and show how the substance abuse impacts the economy, the economic results that you're seeing in Rhode Island.
Last question for you, Doctor. In Rhode Island, we've been raising awareness about a economic development plan the governor has supported from the Brookings Institution. It recommends a top-down government investment in strategic key industries as the main driver of economic growth. Your index takes a 180-degree opposite approach and says that we must look at the grassroots. We must build our economy and family prosperity from the bottom up, from the family up. Can you talk about just quickly that brief fundamental philosophical difference?
Well, sure. We're looking at the ground up because it's the individual that is the worker, that is the father, that is the mother, the breadwinner for the family. And so we're looking at the individuals that make up the most fundamental unit of our society, the family unit, and looking at all those things, all those factors that influence whether they're able to work, how much they're able to work, whether or not they're taking care of their families or not, whether or not they're taking care of themselves, substance abuse, family health, so that they can take care of their families. So we're looking at this from a self-reliance perspective, that the fundamental unit of our economic productivity is the individual and the family.
I couldn't agree more. So to close our segment and to re-ask the question, what's really in your best interest? Is it a top-down approach that benefits with preferential tax treatment, just those special insider companies and advanced industries? Or is it broad-based policies that help the family, that strengthen the family unit, and therefore improve economic outcomes, as your index says? Which one would you pick, Doctor?
Well, I would pick the latter, Mike. I think we agree on that one.
Well, I think we've answered the questions, what's in people's best interest. Thank you, Dr. Wendy Warcholik, for being with us. This has been Mike Stenhouse signing off, working to create a free and prosperous Rhode Island. Thank you. Good day.